Hello and welcome to Health and Wellness Oklahoma. I'm your host Rick Heath, and with me today Kory Reed, a physician's assistant at FedCare. Kory, welcome to the show.
Thanks for having me.
Kory, talk to us a little bit about your background and your training.
Well, I originally got my bachelor's degree at Oklahoma State University in 1997 in health promotion, community wellness. Later went on to PA school and got my master of health science at OU Health Science Center in 2001. So, I hold, right now work at Broadway Clinic where I do FedCare. I'm a member of the OAPA and AAPA organizations.
OEPA, explain that to us.
Oklahoma Academy of Physician Assistants is a kind of a governing body for the state of Oklahoma for physician assistants.
Tell us a little bit about why you chose to get in the medical profession, Kory.
Well, I'm a people person, first and foremost. I think you have to have that to be in this profession. Also, both my parents were in basically civil service type jobs and community jobs. My dad was in law enforcement, my mother was a nurse, so I think it kind of came by naturally.
Kind of came in naturally, and with your personality, it helps with the interaction with the patients.
Absolutely. That's probably one of my greatest strengths, I think.
Is interacting with the patients that you see at FedCare.
Absolutely.
Well, Health and Wellness Oklahoma, we'll be right back after this. And welcome back to Health and Wellness Oklahoma. With us today, Kory Reed, a physician's assistant at FedCare. Tell us a little bit about what you guys do at FedCare.
At FedCare, Broadway Clinic, we provide medical care to anybody basically under the Department of Labor umbrella. So any federal workers' comp patient that gets injured, so albeit Tinker Air Force Base, FBI agents, U.S. Postal Service, anybody that's under that umbrella that has an on-the-job injury, we try to provide care for.
And what kind of treatments do you provide?
Well, we're kind of a one-stop shop. We've got a lot of things at our facility. Obviously, the first thing we do is provide a history and physical examination, determine their problem. We have on-site x-ray, we have on-site physical therapy. If we feel like the problem is greater than that, we can refer them out for MRI. We've got a network of MRI places that we use. And then if it gets further and they need a specialist, like a neurologist, an orthopedist, or a spine surgeon, something along those lines, then we can refer them out for that.
So once they come to FedCare, you can determine what they need and give them all of that full array.
Absolutely. We also have an on-site pharmacy there, which obviously helps with the patient. Instead of having to go to another facility and wait, they can just get medicine there.
And so that provides them with not having to go outside FedCare to get their treatment.
That's correct. It's pretty much self-contained.
That's great. And we'll be back with more about FedCare on Health and Wellness Oklahoma after this. And welcome back to Health and Wellness Oklahoma. We're talking with Kory Reed, physician's assistant at FedCare. Tell us a little bit more about the services you provide at FedCare, Kory.
We try to be a comprehensive medical facility in the treatment of federal workers' comp patients. So from the diagnosis of their injury on through physical therapy, through the specialist, anything that they should need, we try to oversee that and make the process easier for them. After they're finished, once they've reached maximum medical improvement, we actually can also do a permanent impairment rating, which is a disability rating done by the American Medical Association Guide 6th edition that we use to rate people for the disability for that particular injury.
That's got to be very helpful for them to be able to get that if they need that rating.
Absolutely it is, and not only that, that's not well known to them. The employers don't really make that known, so it's something that we can help them to attain.
Now, Kory, is there a lot of paperwork involved in what you do there at FedCare?
Yeah, there's a tremendous amount of paperwork. I'm very fortunate. We have a wonderful staff. We've been doing FedCare for over a decade at Broadway Clinic, so we know the ins and outs. The federal government requires very specific guidelines on paperwork, and our staff is very adept at handling that.
And they can help the patients throughout that long process of paperwork.
Absolutely. Any questions that they need answered, we follow them all along the way.
Kory, I understand that government employees are a very select group here in Oklahoma. There's approximately 84,000 of them in the state. Why do they select FedCare?
I like to think the people is part of it, but it's also the expertise. Like I said, we've been doing this well over a decade. We know the ins and outs of the paperwork. It's a very stressful process if you've never been through it, if you don't have anybody to help you through it. I feel like our track record speaks for itself, that we have helped that many people, and that's why they continue to come back.
Kory, I think our audience has learned a lot about FedCare and about how you guys can help them at FedCare. Thank you so much for being on Health and Wellness Oklahoma.
Thanks for having me.
That's going to do it for Health and Wellness Oklahoma. We'll see you next time on Health and Wellness Oklahoma.